Coronary Artery Bypass Grafting, or CABG, is a surgical procedure. It improves blood flow to the heart. CABG is often called heart bypass surgery or just bypass surgery. The surgery creates new pathways for blood to flow around blocked or narrowed coronary arteries. These arteries supply the heart muscle with oxygen-rich blood. CABG is a major surgical procedure. It is performed by a cardiac surgeon. The surgery involves stopping the heart temporarily. A heart-lung machine takes over the function of the heart and lungs during the surgery. This allows the surgeon to work on a still heart. CABG is generally considered when lifestyle changes or medications are not enough. It can also be an option in emergency situations, like a severe heart attack. Understanding CABG can feel overwhelming, but this guide will simplify the procedure for you. CABG is recommended for individuals with coronary artery disease, or CAD. CAD occurs when plaque builds up inside the coronary arteries, narrowing them and reducing blood flow to the heart. This can lead to chest pain, also known as angina, shortness of breath, and even heart attack. Patients with multiple blocked coronary arteries are often candidates for CABG. Individuals with diabetes or other medical conditions that make angioplasty, which is a less invasive procedure to open blocked arteries, might also require CABG. Sometimes, CABG is the preferred treatment option, even if only one coronary artery is blocked. This might be the case if the blockage is in the left main coronary artery, which supplies a large portion of the heart with blood. Deciding whether CABG is the right treatment is a complex process. This involves careful evaluation by a team of healthcare professionals, including a cardiologist and a cardiac surgeon. CABG involves several key steps. First, the patient receives general anesthesia. This ensures they are asleep and pain-free throughout the operation. An incision is made in the chest and the breastbone is separated to access the heart. Next, a healthy blood vessel, called a graft, is harvested from another part of the body. Common graft sites include the chest wall, leg, or arm. This graft will be used to create the bypass around the blocked artery. One end of the graft is attached to the aorta, which is the main artery supplying blood to the body. The other end is connected to the coronary artery beyond the blockage. This creates a new pathway for blood to flow to the heart muscle. Once all necessary bypasses have been created, the heart is restarted and the breastbone is closed. The incision is then sutured, and the patient is taken to a recovery area. Recovery from CABG typically requires a hospital stay of several days. During this time, the medical team monitors the patient's heart function, pain levels, and overall recovery. Patients are encouraged to gradually increase their activity levels. They will receive guidance on wound care, medication management, and lifestyle modifications. The success rate of CABG is generally high. Most patients experience significant improvement in their symptoms, such as reduced chest pain and increased exercise capacity. The long-term outlook after CABG depends on various factors. These include the patient's overall health, lifestyle choices, and adherence to medical recommendations. If you'd like more information on CABG and how MedWorldIndia can help, please visit our website at website address or call us at phone number. Our dedicated team is available to answer your questions and guide you through every step of the way.